Hey everybody, happy Friday! Happy Friday! Come on in. Come on in, guys. It's Friday, which means I am back to try to answer one of your questions from the comments. If you have questions for me, put them in the comments. We grab these up and I try to take them, and I'm just working my way through them. It takes some time, but I'll do my best to try to answer the questions that I get. I got one last week. It's a hard one. The question is, I'll read you the full one. Let's talk about the super competitive hiring market and getting into actual wage offer wars and how to compete when your budget doesn't allow you, but you desperately need the person. Oh man, I am hearing a lot of questions about wages. A lot of support staff are saying, "Hey, what should I get? What should I be getting paid?" And I'm seeing a lot of job offers that are that are impressive. And maybe I should be making more money, and maybe I should be looking at these job offers. And what do I say to my boss when I feel like other people are getting paid a lot more than I am? And I am hearing these questions all day, every day. And I hear questions just like this from managers, from practice owners, from veterinarians who are like, how do I love my people. I love my staff. We don't have a magic money tree to pay them, and I don't want to lose them. And what do I do? So let me take a crack at this. All right. So first thing, it's important to know that what we're seeing with wages and stuff in vet medicine is not vet medicine specific. This is across the country. This is probably across the globe. People are quitting their jobs at record numbers. People are they are burned out after the pandemic. They have had a lot of stress, and they say, I don't want to keep doing this stressful work at the level and the way that I have before, and I want to look for something better. And so we are seeing that across all industries. Guys, I think vet medicine got hit really hard. We had a year of getting our butts kicked, and I think all of us are burned out. I think all of us have been working so hard, and then we end the pandemic and go straight into the crazy summer season, and we're all working like crazy. And so I think we have a lot of people who are tired, and they are burned out, and they're compassion fatigued, and they're kind of like, I don't want to keep doing this at for what I've been getting paid in the past. The other part of this just is supply and demand. We have got a massive shortage of skilled laborers. That's doctors, that's technicians, that's experienced assistants, practice managers. It's just a shortage of labor. And classic supply and demand is when there's a lot less of something, the demand for it goes up. And that's what we're seeing. And we're seeing some groups, like corporate groups, people who have some resources, they're actively trying to recruit. And of course they are. They're like, we need more skilled labor to expand. Guys, I know tons of doctors who are really limited by the number of staff they have. They have doctors, they don't have staff. And I have other places that have staff and they don't have doctors. And they got all the cases in the world, way more than they can possibly see, but they don't have the manpower to actually see it. And they say, I am desperate to get people, but it's just very hard to get skilled labor. And so that demand drives prices up. So that's where a lot of this is coming from. To the owners out there, to the managers who are like, I don't know what to do about this, and my staff is asking for more money, or they're showing me competitive job offers. What do I do? I think the first piece of advice I would give to you is you can't take this personally, and it's really easy to be like, you're saying that you're gonna leave if I don't pay you more money. How could you? Like, man, when you make $13, $14, $15 an hour, and somebody offers you $18 an hour, that's not nothing. That is a significant difference. And money's not the only thing in a job, and everybody should know that. Anyone who's worked in a toxic practice knows that money is not the only thing. There are a lot of other things that make a job worth doing and worth being in. But at the same time, you can't fault employees for looking out for themselves and their families and saying, hey, this is what is available to me. And honestly, you should take it as a favor that they come to you first and say, I love being here. I love working for you, but I'm seeing this, I've gotten this job offer, and I wanted to let you know because I like you here, but I can't overlook the difference in what this would mean in my life. Man, you can't get mad about that. That's just, like that's just being honest, right? That's just a professional thing. And when somebody comes and says something like that to you, it's not an indictment of you. It doesn't mean you're not a wonderful boss. They're just being honest about what they see and kind of what they need. And I talk a lot about vet medicine being a relationship, right? We're all in a relationship together in our clinics, and I want you to be open with me, and I'm going to be open with you about what I can do and what I can't do, and I don't want it to be a personal thing, but it's just clear communication, honest expectation. So number one thing is don't take it personally. I think it's been a hard time in vet medicine because we're all getting pinched, and the volume of cases has been so big, and we're all just doing our best. And guys, I think that we have all tried so hard to shield the pet owners from pain, from discomfort, right? We have all done everything that we can, bent over backwards, to get pet owners in and to see those pets and to see those patients. And we all really want to keep medicine affordable. I know that's a big thing for me, is I don't want to price vet medicine out of the reach of people. And so I think a lot of us have done that. I do think, however, when we get to this point and we're trying to retain our staff and they're looking at other wages and going other places, if we want to stay in business, if we want to continue to have healthy practices, we're going to have to probably pay our staff better. And again, this is very regional. And I'm not just, like this is not a national thing where everything's the same. Obviously what people get paid in Boston is different from what they get paid in rural South Carolina. That's always going to be different. But I think a lot of us have held our prices down, trying to do right by the pet owners and also trying to do right by our staff. And when we see this and we say, hey, look, man, our people we're really working them hard and they're really worked hard, we may have to say, I'm sorry, pet owners, but prices are going to have to go up so that we can incentivize and keep our staff and make them want to keep coming to work, right? Like, again, it's not personal. It's just about trying to take care of everybody. We always have a balance, right? It's always a balance between taking care of pet owners, taking care of the staff, and taking care of ourselves. And so it all kind of works around to that. But there's really only three options that we have if costs of labor are going up, if our budget doesn't allow for us to give our people raises and they're looking at going other places, we can be more aggressive in our recommendations, right? We can work up our cases more. We can really get serious about making recommendations for wellness care. So we do more services and bring in more money that we can pay salaries with. We can get more efficient, meaning we can see more cases with the people that we have, so we bring in more money that way. I think a lot of us are working probably as hard as we can, but there may be places to add efficiency. And the last is to raise prices, right? And it's supply and demand. When we can't get all the clients in for the day, we may need to raise prices to try to slow down demand, but also to be able to retain our people who are working so hard. And so I think that's a hard choice. But I do think a lot of our practices are going to be probably looking at some fee increases to pet owners. That is going to go probably almost entirely to retaining our support staff and trying to attract talented people. And again, I don't like that, but I don't see a way around it. And I don't think it's fair to sacrifice our support staff and be like, hey, we got to keep care affordable, so you guys are really, you're not going to get raises, you're not going to get a living wage like that. I just think it's one of those hard things where we're all trying to balance it, but I think that's probably where it's going to go. Some of the stuff that I want to say with thoughts on this, and to say to the employers, right? When your staff comes in and they say, hey, I need to make more money, or hey, I'm seeing this job ad down the road, and I'm going to need a raise or whatever. Number one, don't take it personally. Right, like that's you just got to do that. It's not about you. It's really not, right? Number two is you don't have to have an answer right this second. And I think a lot of people panic and they're like, she's looking at me and she wants to get a raise and I don't know, and I have to look at the books and I don't know what else to do. Look, that's too much pressure on you. You can say, look, I hear you. Let me look into this. Let me sit with this. Let me see what's fair to everybody. Let me see what I can do. And just give me some time. Give me a couple of days. And just ask. Just say, I gotta take some time. But set some expectations. You're not a genie. You can't rub the lamp and immediately get people. Like you got to take some time. You got to look. You got to see what you can do. So the first thing is just say, hey, set realistic expectations. I need some time. I got to do this. Remember that you got to be fair to everybody, and say that to the staff as well. Right? We're moving towards an era of wage transparency, which is good. Right? people kind of want to know that they're being treated fairly. And I think you're seeing more and more vet clinics move towards wage scales, which again, I think is good. I think it's good that you say, hey, this is where you are. This is your training. This is your knowledge. This is your expertise. This is your job you're doing. This is basically what you're going to get paid. And other people who do the same job as you get paid the same. And here are the things you need to do to move up in the wage scale. I think that that's where we're going as an industry. I think it's probably good as far as equality and treating people fairly and people feeling like they have some control over their destiny. So all that to say, I can't just take one person who comes and asks for a raise and yank them up and not bring up everybody else. So, remember, this has got to be fair. Meaning we're gonna have to look at our wage scales and kind of how we treat everybody, and the people asking for raises should know that, which means I can't just take care of you. I've got to take care of everybody. But I hear what you're saying. And the last thing is, ask for some time. Right? This is going to take some time. You're like, nobody's going to walk in and be like, hey, I need a big raise. And you're like, I'm going to adjust all the wage scales and I'll do it right now and everybody will get paid differently. That's not going to happen. But again, when the staff come and they ask us and they tell us what they're doing, it's not personal. But we also, these are reasonable. These are real people. You know these people. They're good people. You work with them all the time. They're reasonable people. Listen to them, listen to what they have to say, explain to them kind of where you are, and do your God's honest best to meet them in the middle and try to come up with a way that we can work together. But anyway, it's going to take some time. You don't have an answer now. I think most people understand that. I was at the vet clinic yesterday, and I had a vet student in visiting, and she was wonderful. She was really great. It was wonderful. Emily, it was great to meet you. She was wonderful. Go Gators, Gator vet student, and she was talking to one of the technicians who she had known from high school. And I heard him say to her, he said, this is, we do good medicine. It's a good job. We have good bosses. You get treated real well. Not much else you can ask for in a job. And I was like, man, that's good stuff. Like that's what we live for. And so money's part of it, and we have to compensate people. We have to take care of people. But, for the most part, do your best to provide a good environment for people to work in, to have a good culture, and do your best to take care of them. And guys, we're all going to be patient with each other, but let's keep working together and work through this. But ultimately, I think this is going to be a good time for our profession in the long run. But times of change are always hard, and change is always challenging. But I do think we're going through a time of change right now. So anyway, everybody keep your chin up, keep working hard, keep communicating, keep taking care of each other. But this too shall pass. We'll get this sorted out. But honestly, I think things are good for our profession. I think things are going to be really good for our support staff. I think we're going to another place. That's going to be a more robust maybe profession in the future. Anyway, it's challenging. We're pushing a boulder up a hill now, but I really do think there's good things in vet medicine in the future. All right. Take care, everybody. Have a wonderful Friday. I'd love your questions down in the comments, and I'll see you guys next week. See ya. Bye.